Pleasant afternoon, good morning, and good night for those of you who are joining us from various parts of the world. Hearty welcome to the Ministry of Health and Wellness 12th Annual Conference. Today, we are at the final session, bearing the panel discussion theme, Gender-Based Violence and COVID-19. You may wonder about the term gender-based violence. Actually, this very unfortunate term was named in the early 1900s by the United Nations Declaration on the Elimination of Violence Against Women. It didn't have a name, but it existed before Christ. And so we have four presenters here, four very august presenters. Mrs. Diahann Gordon-Harrison, Senior Superintendent Stephanie Lindsay, Dr. Elizabeth Ward, and Reverend Jason Downer. I am going to introduce the first speaker, Mrs. Diahann Gordon-Harrison. She's an attorney at law who has been the Children's Advocate of Jamaica since January 2012 and has been Jamaica's National Rapporteur on Trafficking in Persons since March 2015. Making her the first to hold such a post in the Latin American and Caribbean region. Prior to her appointment as Children's Advocate, Mrs. Gordon-Harrison served as Deputy Director of Public Prosecutions. And since 2020, she is a serving member of the Board of Directors for the International Society for the Prevention of Child Abuse and Neglect, which is a United States-based profit organization that works in over 200 countries worldwide. Please put your hands together and welcome Mrs. Gordon-Harrison.
First, let me extend thanks to Dr. Crawford for the very warm welcome, and more broadly to the Ministry of Health for having invited me to be a part of this panel. Of course, it goes without saying that I feel quite at home, having done quite a number of collaborations with the Ministry of Health and Wellness. Now, the topic of this afternoon's panel discussion is gender-based violence and the COVID-19 pandemic. And being a student and a lover of history, I always like to start with the context. And so in very simple terms, what is gender-based violence? So gender-based violence essentially is when you target an individual because of his or her gender for the purpose of exploiting or making that person susceptible to receiving the violence that you're going to be perpetrating. And so if we use that context, we can perhaps just reflect very briefly on who the persons are traditionally in Jamaica who are predisposed to being the recipients of gender-based violence. Now, typically, based on our statistics and our cultural context, we have found that girls and women are the ones that traditionally bear the brunt of being victims of gender-based violence. Now, I hasten to add, however, that though girls and women are more predisposed to being victims of gender-based violence, we cannot for a moment think that boys and men are not also targeted and violated for this particular issue. So when we think about that historical context where our women and girls are the ones who bear the brunt of this violence, let us layer that with the reality of the COVID-19 pandemic. Now, the COVID-19 pandemic, like many other pandemics, are a once-in-a-generation experience. And so we in Jamaica, like the rest of the world, are living in unprecedented times when things seem to be out of whack, everything is in flux, and there's nothing that is certain, or we don't have the precedent for how certain things are going to manifest. So this is a global crisis, much like any other crisis, which means that we have very, very uncertain parameters within which to operate. So what the COVID-19 pandemic has done is it has exacerbated the vulnerabilities of those among us who were already on the periphery and in fact more predisposed to exposing adverse experiences. So what it means, if you think about it then, is that we're operating in changed social realities that were in fact imposed as a matter of law and as a matter of responding to the public health crisis that we're operating in. So it means, therefore, that while we continue to grapple with the health component of it, there is a social component that continues to unfold. Oh dear. That continues to unfold that we're having a problem grappling with and adjusting to. And what we're seeing is that with this changed reality, the vulnerabilities of the marginalized really have become that much wider. So what are we seeing as some of these changed social norms as a result of the legal manifestations? We have seen certainly a slew of curfew orders mandating that we have to be off the road and in home by a certain time. We saw no movement days for periods at a time. We have seen school closures largely from March of 2020. We are seeing where persons have been confined to their homes and to their communities, where they're sometimes commingling with perpetrators of violence, where they are the victims. So what then is the effect of all of this? First of all, there is heightened frustration on all fronts. The victims are frustrated, the perpetrators are frustrated as well, and we're having almost a toxic mix of frustrations, all confined to the same space because of the confinement to home. We're seeing also an absence of any meaningful outlets to really deal with these frustrations. And that, of course, is a recipe for further disaster. We're seeing reduced or absent coping strategies being communicated to persons who have these frustrations. And so we're seeing, therefore, a kind of culmination of different factors which lead to increased opportunities for violence, abuse, and exploitation. What then are we seeing on the ground? From my perspective, we're seeing that girls, for example, who have been out of school for many months, are confined to homes and communities where they are more accessible to the dawn. They are more accessible to persons who have bad intentions, who take advantage of the lack of structured situations that these girls are now in, and use that as an opportunity to exploit. We're seeing as well, if you think about the human trafficking side of things, whereby we have more girls who have shown up as being victims of sexual exploitation. So what we're seeing is that all of these disrupted structures and the norms that used to exist prior to COVID-19 are being almost taken advantage of by those persons who have an intention to continue to perpetuate gender-based violence against our girls. The women aren't to be left out, and I'm sure Superintendent Lindsay may touch on this, in terms of the domestic violence concerns. We have seen, for instance, where the gender of Bureau Affairs have basically said, you know, we are now accelerating the access to women and those men who may have an issue to help that needs to come their way to assist them to deal with the increased instances of violence that they're facing. We also have the shelter that caters to women and their children who are victims of gender-based violence. And certainly since the onset of the COVID-19 pandemic, we have had increased focus and increased calls on creating these safe spaces for women and their children who need this route of escape, if you will. Now, as I said, our responses seem very heavily geared towards females. And again, I think because historically our context has shown that it's the women and the girls who bear the brunt of it. Very recently, however, and I'm very happy that this discussion has taken place, is that we have seen where, because it is a fact that there are some men and boys who feature as victims in this arena, there is focus now on providing the support to these men and boys who may need it. We continue to struggle, however, with the social stigma, as it were, that's attached to any male who says that they're a victim of certain types of offenses or certain types of treatment, because, of course, of our historic masculinity discussions and the consideration about what's manly and what's not manly. So in my own view, there has been an underreporting and therefore an underrepresentation of the men and the boys in our statistics who are victims. But what is very encouraging is that we have shifted the dialogue and we continue to provide meaningful access to assistance for these males who may in fact fall prey to gender-based violence. So in closing, and in a bid not to exhaust the 10 minutes that have been allotted, the essence of the matter is that the COVID-19 pandemic has caused those who are on the periphery and who were victims before or predisposed to receiving violence to be even more so predisposed, because vulnerabilities have been exacerbated, coping strategies are thin, and we have persons who, because of the power dynamic that exists between themselves and these less, I would say, assertive individuals who are the victims, that continues to be exacerbated and continues to be an issue. So as we move forward with this panel discussion, one of the things that I think we need to focus on is just what are some of the meaningful strategies that can be brought to bear to close the divide, to close the power dynamic that makes victims continue to be victims, and of course to connect these victims with meaningful support and access to help. There are two that I'd like to put on the table as I close. One is certainly in relation to our girls. We now have an outlet through a 24-hour helpline that operates 7 days per week that connects girls who are really victims of any sort of violation to have connection to psychologists and counselors who can help them to cope through whatever it is that they're going through, and also who can connect them to systems of help that exist. The Victim Support Unit as well, out of the Ministry of Justice, continues to reinvent itself and continues to provide meaningful support to not only girls, but also to women and other victims who may need the assistance. And I think we need to have a solutions-based approach to this discussion this afternoon. And I want to thank you again for having me, Ministry of Health, and I look forward to hearing the discussion that will be led in this panel this afternoon. Thank you very much.
Thank you so much, Mrs. Gordon-Harris. You know, as she spoke, there are two things that jumped out at me when she mentioned about the public health issues of GBV. That's not the only focus, but we also have to look at the social dynamics that we have to contend with. And I just want to use this opportunity to say that GBV is not only a health issue. It's a security issue, justice issue, labor issue, climate change issue, and the list goes on. And when she spoke about the gender of bureau affairs, it reminded me of the program of action that the ministry has put in place, as the Ministry of Culture, Gender, Entertainment, and Sports. That program of action for gender-based violence for Jamaica covers the period 2017 to 2027. And so, ladies and gentlemen, work has been going on in Jamaica. And so I want to thank you, Mrs. Gordon-Harris, for bringing that up. Okay, so our next speaker is Senior Superintendent Stephanie Lindsay. She has over 26 years policing experience and has worked extensively on the development of strategic communication and brand support in the Jamaica Constabulary Force, referred to as the JCF, and this has been over 20 years. She was instrumental in the creation of the Constabulary Communication Network, referred to as CCN, now Corporate Communications Unit, CCU. She served as Jamaica Constabulary Force CCN Liaison Officer and is now both officer in charge of the CCU and the appointed spokesperson for the JCF. Senior Superintendent Lindsay is currently pursuing a Master of Science degree in Security Studies at the Maritime University, and she is already the successful holder of a bachelor's degree in Leadership and Management and a diploma in Secondary Education from the Jamaica University College. Hearty congratulations, Lady Lindsay. She works extensively on studies related to the application of community-based policing principles, and she lectures on communication at the National Police College of Jamaica. Please put your hands together and welcome the Senior Superintendent.
Thank you, Madam Chair. So the Jamaica Constabulary Force has been at the forefront of the fight against COVID-19 since it first hit Jamaica in 2020. Our role as law enforcement practitioners were stretched to another level because we supported the Ministry of Health and the Ministry of Local Government in enforcing the Disaster Risk Management Act. Most of the things that our first speaker, Mrs. Gordon Harrison, spoke about, all the measures that were imposed and had to be enforced, was the responsibility of the Jamaica Constabulary Force. So we saw our role not just from a law enforcement standpoint, but also doing things that were not necessarily core functions for the Jamaica Constabulary Force. And as we look at what we're discussing today, our role within the context of gender-based violence, some of the things that we saw coming out of our experience working with enforcing the Disaster Risk Management Act, and at the same time policing one of the violent period in a society, because one of the issues that we continue to grapple with as a society and as a police force, the high incidence of violence among community members. And we don't think the pandemic helped to alleviate those challenges. As a matter of fact, in some instances, we saw where the very provisions that were put in place to save lives and prevent persons from contracting COVID-19 also became a contributing factor to some of the incidents of violence that we saw. One of the major ones that I think jumped out, the whole question of the lockdown. Because in normal circumstances, there are persons who don't get along. Even though they share the same household, they share the same space, they never got along generally, but they had a mechanism in place that they could treat with it, that somebody would probably walk away, somebody would stop maybe for the men, they would hang out with their friends at the bar for a while and allow things to cool off, or you could drive out for a while. Now that was a breach under the COVID-19 regulations, so little things that would not matter in a household became a problem. So we saw the increase in the family violence and the disputes. We also saw domestic violence rising, and there were other matters of abuse. Even children who were part of that whole setup were exposed to abuse and violence as a result of that. So we still had to do what we had to do because we had a responsibility. Another reality that came forefront to us was how persons lived in normal times as opposed to COVID-19. Again, space became a factor because there were persons who had limited space, especially some of our inner city communities where we have large family numbers living in a small space. Then you find that those persons over time worked out a system as how they share the space. So a particular group would go out at nights, some would sleep, another set would sleep in the daytime, another set would go to work, and they would come in and they would find a way to share that space. COVID-19 didn't allow for that. So a lot of persons, we get more calls in the latter part to respond in support of our persons in the health department to treat with matters of mental illness than we had before. So we got a lot of calls about domestic violence to the extent where one of our responses was to really strengthen our response of our members to these domestic disputes and gender-based violence. And we saw it both ways, violence against male, violence against female, but most of the reports that we got, violence against women in those instances. So we had to go through a process of first preparing our members internally to treat with these increase in reports and to be sensitive towards the needs of the victims, as also to see how best we could reach out to the perpetrators of these violent acts. So we did training, and we train at every police station across the country, someone to be the point person that respond to these reports of violence. We also appointed in each of our 19 geographic division a gazetted officer to be the person that is responsible for coordinating these activities, because we have reports that persons have gone to some police facilities and they were not satisfied in how the matter was treated with. So we had a gazetted officer that was the point person that would monitor all these reports and to ensure that there is feedback and support for the victims and the matters were not left unattended. So nobody, as a matter of fact, Commissioner took it on himself to lead. He led on that campaign, internal campaign, and the message to the members that no one should be turned away. So no matter how you come, if you turn up at the police station not properly attired, not in keeping with what would be normal activities, no one should be turned away. We went further and we strengthened our domestic violence, and we call them our eye care centers. Domestic violence, and the I was for intervention, the C for counseling, A for awareness, R for response, and E for empathy. So the eye care centers, some are already established. The goal is to have 11 centers up and running before the end of 2021. And so far, we have 9 are in place already, and the others are under construction. And what these centers allowed for were for reports that came to the police where a breach was not committed in the first instance. So you will get the threats and you will get the reports of abusive language and all of that, and a very toxic situation. Now, if you're going purely by law enforcement practices, you may not be able to find an offense that can be put before the court, but it doesn't mean that there's not a problem that, if left unresolved, could lead to something more serious, to include death. So the DV eye care centers, in collaboration with partners and volunteers, and a number of the volunteers are trained professionals in psychology and counseling that volunteer their time island-wide to give hours of their service to treat with these matters. So when they go to the front desk at the police station, they would be referred to these centers. And in that problems, in that solution-based approach, we also engage the perpetrators. And we find that it helped. There were matters that we still had to put before the court, because in addition to a detected offense that will be dealt with in the court, there were also other underlying issues, if left unresolved, could lead to the continuation of what was happening in the force. There were instances when even the children in the family were part of the dispute and they were part of the abuse cycle. So these eye care centers, we use them to, in addition to all that we were doing, and in addition to putting a matter before the court, really to help resolve some of these issues. And we are really grateful to the many volunteers. Some were from the church, from the medical fraternity, other volunteers, other professionals. And we find that the best way to treat with the matters of gender-based violence, domestic violence, family violence, community violence, is where we collectively support from wherever we sit and whatever forum we find ourselves in, is to reach out to somebody, because there are some things that we cannot use law enforcement practices to get our way out of. We will have to resort to other things, and the Jamaica Constabulary Force fully embrace the concept of collaboration that will lead to ultimate problem solving to reduce the incidence of violence in our society. Thank you.
Thank you very much, Lady Lindsay. Let me say a hearty congratulations to the Jamaica Constabulary Force for establishing the training exercises and appointing a gazetted person to deal with something as sensitive as violence. And when you spoke about not turning anyone away, it reminds me of the Sustainable Development Goal Agenda 2030, which says leave no one behind. And this is what we work towards today. Our next speaker is going to be Dr. Elizabeth Ward. She is one of the greatest epidemiologists of all times. She has spent most of her professional career examining the data behind illness and how to control them. She has taken a data-driven approach to assist in curbing numerous public health issues, and for the last several years has been using that approach to combat crime and violence in Jamaica. Dr. Ward launched the Violence Prevention Alliance in 2004 and has been gathering data, identifying patterns, and mobilizing vehicles of community intervention, such as the non-governmental organizations targeted at social development in specific communities. Thank you, Dr. Ward. The Violence Prevention Alliance has helped in the tabling of the National Plan of Action for an integrated response to children and violence before Parliament. This is a plan with a target of reducing child violence to zero by 2030. And ladies and gentlemen, you know, when I think of this, it reminds me of Sustainable Development Goal 5, which is aligned to gender-based violence. And it specifically speaks to gender equality. And when you look at Sustainable Development Goal 5, you can actually connect the dots to at least 7 other goals, which deals with poverty, hunger, climate change, education, you name it, and the list goes on. So they are not disconnected at all. In order to achieve this goal, one has to make sure that there are alignments. And so I now turn over the floor to Dr. Elizabeth Ward.
Thank you so much. It really is a pleasure to be here and part of this really important work that the Ministry of Health is doing, holding the research days and sharing vital information. I am an epidemiologist, but there are many, many greater ones than me. And I've worked with many excellent people and learned so much from all of them and continue to learn. So today, what we're really looking at is something of great importance to us, and the issue of gender-based violence and COVID-19. And this is a map of violence-related injuries across the island. And what happens with it is that you can actually go down to the community level and identify, well, you would call it hotspots. I think we call it hotspots too. We might have slightly different definitions. But we see concentrated areas of violence, and within that, we also know that there are women and children that are there affected. When we look at COVID-19 and look at the stresses and the patterns, we're more now concerned about the patterns and the uptake of the COVID-19 vaccine. And this was some very interesting data that I saw about the number of deaths that were occurring due to COVID-19 that were compared to deaths from violence in the US, deaths from motor vehicle accidents and other issues. But what was also important in it is that the deaths that were occurring from COVID-19, which were much higher than all of these other conditions that we know about, were much higher in partially vaccinated or in the US, because most of their persons are there. So it just reflects on us another strain and stress of us, how we respond to a new epidemic, a pandemic that is affecting the world. So we know that it's this little virus here, and we know that, as all the other presenters have said, that we're all under stress, wearing masks. I wish I could smile with you properly. Social distancing of the 6 foot, the impact of curfews and lockdowns, and as I just said, about the stress and strain about vaccine, not to vaccinate, yes, but we know it makes a difference in saving lives, and especially in our older population. This is looking at the whole issue of domestic violence. And there is a big social superiority issue and power issue and different issues that are there. There's the idea of, physically disciplining partners and those types of beliefs. And also that, unfortunately, a lot of people in Jamaica, a lot of us feel that we can resolve our issues by violence. And that violence brings more violence. So we've done work over the years, and especially on violence, looked at the impact on our hospital system, which is where I got involved in looking at the cases of violence. And when we saw that 1 in 4 of the surgeries at KPH, the elective surgeries, were being cancelled, said, what's causing this? And they said, oh, well, we get a gunshot wound or a stab wound and it interrupts, and the whole case, the whole list has to be cancelled. But also on another point, besides the workload on the staff and the stress on the whole system, is the huge cost of billions of dollars a year that is preventable. And we're seeing the same thing with COVID right now. All the schools, the lockdowns, the students who have lost years of work, the stress and the strain of testing and movements and all the issues. So when we look at the data, there's a direct effect of the epidemic versus the pandemic. We're looking at violence. You have to look at the homicide rate. You have to look at the crime rate. And with the COVID pandemic, we look at the infection rate, and you look at illnesses and death. So there are so many things that are going and happening to our people, and I'm sure Rev will talk more about this. But, there's the whole emotional set of issues, the impact on our relationships, the impact, I'm going to have to remove my mask, I missed it up. The people are becoming more self-protected. They have to looking inwards, trying to survive. The increase in vulnerability, especially when you feel you can't control what are the government responses, the lockdowns, the health restrictions they're imposed from outside. And the impact of the ZOSOs and the SOEs themselves. So we see all of these changes in the percentages of, especially in our mental health issues. This sort of summarizes it, though. I think many of us have come to a halt. We're hungry, we're angry, we're lonely, and we're tired. And one of the things that is there is when it's one case, you feel sad. When it's many cases, it becomes a statistic. And somehow, we just hear the numbers, and we hear over 1,000 homicides, we hear 60,000 COVID cases, 80,000. We become more and more sort of affected by this. And this comes from something I answer. So what we really have to understand is how we are responding within ourselves to this threat. And there is a neurobiological response that is happening, and you could look at it. But mainly what is very worrying is if we have low levels of stress, we can positively respond. But when it becomes, goes to another level, it becomes tolerable. You can manage it, but maybe you're not sleeping well and things like that. But then it can become toxic. And this is where we see very bizarre changes in behavior and issues like that. So this is on top of what we know our children and people in our communities are growing up with. They've experienced all the violence from childhood. And then what we know is that once you've experienced these childhood experiences, that you're going to have an increased rate of all of these conditions in a normal situation. So now we have COVID on top of the violence and all of this to deal with. So it's actually affecting the architecture of our brain, and there are different parts of the brain that are from the amygdala to the hippocampus to the prefrontal cortex that is affected. So how do we at VPA and in some of the other work I'm working with the citizen security program right now on the citizen security response, all of government response to that. So, but as an NGO, we have always been looking at all of these issues and being able to respond with a data-driven approach. But we're trying to use the data to help policy and to move forward and help evaluate whether or not those programs are working, whether they can go to scale, and making sure that they're culturally and socially representative and you know, deal with our culture and engage our community members. So how we get data on injury surveillance is, or one of the routes that we had set up from years ago, and we're now at JISS 3. But as patients come into the hospital, they're asked four questions. I think it might be 5. Who did it to you? Where did it occur? Why? The method, and the who, where, why, what, and when. Those are the W's that is there. And for all types of injuries, this is asked. But the one that we are here talking about today are looking at it. So that kind of information, especially when you ask the who, and you ask what is the relationship with the person who perpetrated. So this is looking at the 2002 data, and we're looking at over 2,000, almost 2,500 women who came into our hospitals island-wide. And who was it that was reported as a perpetrator of this violence-related injury seen in females? So what we also looked at, this is the data for 2020, and looking back at what happened in 2019, 2020, and 2021. So when you come to girlfriend, boyfriend, what we found, there's an increase in girlfriend, boyfriend perpetration. So we've gone up to almost 32% of the cases saying that's who was the perpetrator. The husband and wife situation has remained very stable at about 5% of the perpetrators. Parents have stayed fairly stable too. The other area where we've seen an increase, and it has a lot to do with in the home, and is other relatives. And this is a big problem with us in our families. It's not your, well, other relatives. There's a big problem within the relations that is responsible for a lot of what we've seen. With COVID-19, we have actually seen a fall in the number of cases caused by acquaintances. It's dropped down to 21%. And we've seen a drop down in the number of strangers. So, and then what we've seen in women, over 60%, there's another place about the location. For women, we're seeing over or about 64% of all cases actually occurring in the home. And then when we look at the type, which I think I didn't have enough time, but more serious injuries, stab wounds, even some gunshot wounds happening within the home. So we really believe it's a shift from the street into the homes. And of course, when that happens, the children are more severely exposed to more violence, or at least witnessing violence, all of which I showed about the toxic stress that they're under. Next. Oh, I'm to do it. Okay, and this is an example of taking from the big picture and just showing the women and children and geographic distributions and how you can prioritize an area. So this is also what I'm saying is about the changes that occur and happen on the brain, and how this actually can, if we don't intervene early, how it actually can cause permanent changes. So there are many issues that affect sexual violence and where it occurs. But social norms, things like access to excessive quantities of alcohol, the inability to resolve conflicts. There are all these risk factors that you can read through of how we see, and understanding those risk factors. That's what we always ask. What's causing it? What's driving it? And now we have COVID on top of it. So we need to look at excessive use, harmful use of alcohol, and to really understand this, and this was done under the CSJP project. It was called a social norms project, and they were looking at women's status, and kind of upon the corner, small group, asking the men, asking the women, asking young people, asking old people, and really amazing how over 60% of the people interviewed said that they saw that violence against their partner was okay, but it wasn't as acceptable in the younger population, which is what I thought was very important. But there are a lot of stressors, and can you imagine now, one of them is income and financing. When you have children at home now all the time, and your wife or your partner, your baby mother at home all the time, and you don't have any money to give them or feed them. There are all these stressors that, and all of these things that go towards social norms. Can somebody move it forward for me? I don't know why I'm not moving it forward anymore. Is it just frozen? Okay, no, it is here. Okay, this is one of the response programs that is really fascinating, done by Children's First, working with men who have an history of that. It's called Male Awareness now. And it's a process of understanding where they got their aggression and their anger. And then they also showed, afterwards, through their therapy and program, that where they saw how they could do things differently. This is Holy Networks up in the hills. Reverend James Bell, and this is Mr. and Mrs. Holy Network, where they ask each other out for a date in front of their peers. And socialization, how many young people now are taught about these kind of things? And when you want to make a move with a girl, some of the graces and ways of getting through are not there. And offering the boys programs and engagement in things like videography, want to earn more money, but also to learn about and communicate what they've learned from these programs. What works and what doesn't work? What doesn't work is like rape prevention training and judo classes and things like that. But what really seems to work, what the evidence shows works, is intervening early, looking at those gender and social norms, looking within the school system and putting programs in there having men who are aware, being able to talk to young people, and even the lawyers to talk to some of the legal issues and what are the limits and things like that. So there's steps, there's the 4 R's, there are other programs like that. And then we have other Jamaican programs, and Children's First now has a program called GAL, but I'll leave that. What are the next steps? We need to make sure we have the data and we have it right to be able to guide us to see whether we're having the response. And I'm probably not going to, anyway, it's also the data collection instruments, so they're standardized. Can the police data talk to the hospital data? Can it talk to CPFSA and the children's advocate? No, I know you're not CPFSA, but you know, the children's services, they're all the different, and the children's advocate database and national family planning information. I think we need to make sure that we're providing things and our services with hospitality, not hostility. We heard very clearly from Superintendent am I right?
Lindsay.
Yes, okay. And what it is, that's the old days they were saying when they went to police station, they say it's man-woman business, no matter come with that. So this idea of no matter how you come, no matter how you dress, because when these things happen, you are under such stress and cannot make these differences. So how we respond, how we talk to people, sometimes they just want somebody to listen and to share and to help them through a rough time that's there. So if we can have hospitality, us in the health services as well, we have to make sure that every point of contact at churches, everywhere that we are offering this. So the, Andreen, what is, oh sorry. Anyway, the other thing is that we need to make sure that it's 2 wings to fly, right? It's like a bird. We do have to deal not only with the women, but we have to deal with the men and provide them with services, and preferably before they get involved in the violence itself. They can learn other ways of communication. Okay, and the last thing is, how do we really prioritize and get our services to the people who need it the most? Okay, and we're online, so anything you didn't catch and the information, but I really think we have a great team here. We're looking at it from a multifaceted approach and having the data to guide us as to where we put our priorities and understanding the evidence of what works and what doesn't work, because sometimes we move away from what's working, and making sure that they have enough resources to do it. Thank you very much, and really appreciate the opportunity to share with you.
Thank you very much, Dr. Ward. That was quite profound and frightening at the same time when you hear that 1 in every 4 surgery has to be postponed because of cases of violence that shows up at our healthcare facilities. It's really frightening. Thank you also for the recommendations, early prevention, early intervention, as you have stated, data speaking with each other. That is something that needs serious attention over the years, even before COVID-19. And you mentioned hospitality superseding hostility, and the fact that data should be, and information sharing should be centralized. Thank you so much for that. And as she spoke about the statistics, it reminded me of a UN report which I was reading recently, which shows that 1 in every 3 women throughout the world has been subjected to violence of some form. To be more specific, 243 million in 2020 alone. you know, and so we really have our work as professionals. We really have our work cut out for us. Our next speaker, and this is going to be our final speaker, for those of you who are just joining, this panel discussion is about gender-based violence and COVID-19. So our next speaker is Reverend Jason Downer. He is a very passionate social advocate who is fully dedicated to promoting family health and addressing some of the critical challenges that males experience. Reverend Downer is the dorm manager at the Jamaica College. He is the author of the book, Fathering Behind Bars. Looking forward to hearing more about your book and where we may find it, sir. He is the president of the Men of God Against Violence and Abuse and is the host of the radio program Raising Boys and the Journey to Manhood. This is on News Talk 93 FM. Reverend Downer has served as co-chair on the Gender Advisory Council and is a consultant to the Lasco Chin Foundation and master trainer in the World Needs a Father movement based, which is located in South Africa. Mr. Downer has a Bachelor of Arts degree in theology with a minor in guidance and counseling, and he is currently reading for his master's degree in forensic psychology. Hearty congratulations, Mr. Downer. We now turn over the floor to Reverend Downer.
Good afternoon, everyone. Thanks for having me to the Ministry of Health. I really appreciate this opportunity to serve. Right? Happy to share this, podium, this space with the panelists here. I loved how I heard in Dr. Ward's presentation the whole aspect of males and reaching men. For a while, I could not understand, recognizing that we have a problem which we have. The matter of gender-based violence is one that is complex and widely discussed. But I often wonder how it is that we treat the victims, which we should, get them out, get them the necessary help. But then the perpetrator, the abuser, who is often, in most instances, well over 70 or 80%, are males. What happens to them? Because when you take the victim out and nothing is done with the perpetrator, the cycle continues, right? So I'm going to take a particular angle. By the way, happy International Men's Day to all the men out there. Big up yourself. Yeah. And the theme is outstanding men leading by example. We're talking about positive masculinity. All right? Not the toxic one or the unhealthy one. Now, I chair an organization called MOGAVA, which stands for Men of God Against Violence and Abuse. And it exists primarily, one, to mobilize, to advocate against violence and abuse in any form and against anyone. Secondly, to mobilize men to play the rightful roles in society, especially where fatherhood and mentorship is concerned, because there's a direct correlation between those two and crime and violence. And in the context of which we're discussing gender-based violence and COVID-19, which we recognize now what COVID-19 has done really highlighting problems that were there already, but it has somehow intensified it. I want to just put a spin on something, because I primarily target men and boys. So I want to put a spin on something and just look at it a bit. The angle, I believe, is either absent or discussed very minimally when it comes on to gender-based violence, is men reaching men as it relates to advocacy and awareness. Men reaching men in the space where men are. Statistics not only prove that well over 80% of our household where women and children are led by either single mothers or grandmother. But it proves that fatherlessness is the #1 predictor of crime and violence. And understand that fatherlessness does not mean the absence of daddy only from the home. But the absence, daddy could very well be present, but the absence of the quality relationship. Now, where am I going with this on GBV? Watch me now. The role of a father is to, of course, provide, protect. But we want to look at also nurture and also to model healthy masculinity. Now, if 80% of the household is led by a mother, and household with children is led by a mother or a grandmother, it simply means modeling how one deals with conflict between a man and a woman is absent, particularly where the male is concerned. That absence, I believe, a youngster, primarily male, and I'm talking about the person who's primarily the perpetrator, he grows and he lacks emotional intelligence and self-regulation, particularly when you come on to IPV's intimate partner, because growing up, and it's a theory, he never saw in his home how daddy dealt with disagreements where mommy is concerned. Couple that with the toxicity in the music and the type of culture that we have helps to create a certain type of, Blacker Ellis would say, not toxic masculinity, because toxic means no longer good, but unhealthy masculinity that can actually be treated. So the broken home, not seeing the modeling of what should be harmonious in terms of relationship and dealing with situation from the male perspective, that being absent, coupled with the other institution that should also help to fill a void, bridge the gap, the church having its issues, because you have unhealthy masculinity being displayed, leading people. Then you go to the school, where again, we have another problem, because we lack males in the school, and then those in the high schools as men who we look up to, the coaches, a lot of them put up with some stuff that aren't healthy. So what do we do? Well, what Mogava has been doing is going to certain spaces and beginning to train and to advocate community-based organization to first do an internal audit of one, because we do believe males need to engage males. And I can tell you, based on just observational analysis, when men sit and talk with men, somehow they listen. So maybe it is, in light of all that has been said, as a possible solution, we get more male advocates. Just recently we had something, Spotlight Initiative. We had Cars and Conversation and Bands and Conversation. Cars and Conversation at Dover Raceway, because men love cars and racing. And we fused the context of car, and in between mention about what is happening in terms of violence against women and girls. And you will be surprised that when you state to a man, 1 in every 4 women are abused, whether physically, sexually, or otherwise, the light bulbs start to go off, because he has never looked at it like that. You know why? When he sees the term GBV, he automatically shuts off, because in his mind, GBV means we are the perpetrator. We are the only one who's wrong. So in some context, the wording is also important. So to get a man to the table, to talk to him, sometimes maybe we have to use the word family violence, and then now you bring him to the space where he can now be more accepting of what the term is and appreciate it. I do believe that for us to really turn this table, because unfortunately I do not, and yes, I'm a minister, I do not see in the statistics where father presence in the home increasing anytime soon, unfortunately. And so we have to find strategic ways, primarily through the schools, maybe through the guidance department, through the deans of discipline department, partner strategically where we reach our men. We have to get some of these coaches who are the father figures that some of these youngsters look up to, train them, help them to look at what masculinity really is, look at some ways that really don't match up, because these are some of the things that influences what it is that we see. So I propose that a little more resources, a little more effort be placed on reaching men where they are. And I can say this, we will be a bit surprised to find out how receptive the men are to the conversation and to what can be done. Men reach men. That's all I have to say. Thank you.
Thank you so very much, Reverend. Let me say thank you to all four speakers. Of course, when Reverend touched on the point of absence of fatherhood in the home and men speaking to men, it's a conversation that I too see continuing for a very long time. I'm now going to open the floor for questions. For those of you who are online, you may put your questions in the Q&A section. For those of you who are on Zoom, that is, put your questions in the Q&A section, not in the chat. And for those of you who are on YouTube, welcome again. Now the floor is open.
Okay, first question. If a person is experiencing gender-based violence, what are the critical steps and how can they seek help?
If a person is experiencing gender-based violence, what are the critical steps and?
How can they seek help?
Okay, and that is in Jamaica.
Well, just to say, there are a lot of hotlines that are now out there. Of course, you have Women's Inc. You have always the police to go to. And so it's a matter of tapping into the numbers that are there. There's also, must make mention, I believe, I don't know if the superintendent spoke of it, and I'm not sure, but as it relates to a shelter that is also available. But there are spaces there, and I'm sure the Ministry of Health will put the numbers up that are there.
And Dr. Gordon,
Yeah.
spoke about the 24-hour hotline, which operates 7 days per week for girls. Congratulations. It's such a relief to see that that exists.
If I may, it's
Yes,
for girls
please.
and boys.
Girls and
Anyone under
boys.
18.
Okay, girls and boys. Thank you, Lady Harris. Any other questions?
I mean, there are some very systematic steps of securing yourself, protecting yourself, with their specific sort of steps that should be taken if an incident does occur, and how you minimize harm and separate yourself from the perpetrator, even, and look after your children. So there specific steps, and also, making sure that you have other family members or friends that can assist you, and the process of managing the situation and not responding, and also worsening the situation by responding, is part of it. So but the main thing is what we see with very serious cases that come to the hospital or even land up dying, is that problems have been going on for a long period of time, and there's often a lot of cover-up all across the society. One of the similarities with gender-based violence and COVID, it affects everybody. But in certain sections of the society, we don't talk about it, and maybe not even be as willing as we should be to get services. So many times when we see them in the health service, this problem has been going on for a long period of time, and it has not been dealt with effectively. So we often, there's always a history. And if we can interrupt that history and prevent the worsening situations and help work out some of the drivers by understanding what are the situations, we can improve the situation and work more effectively that way.
Just to add, sometimes the support system isn't there, and because persons are so get caught up with, well, I tried to help her before, but she changed her mind. Just saying to persons who know of persons who are in the situation, to try to be a bit more sensitive. I mean, not many people understand the whole Stockholm Syndrome, but sometimes we need to continue to give listening ear and to also to direct, regardless of if the person came to us before and they changed their mind. It's very important for those of us who are not in the situation directly but know of, to be that support that persons need, to hold their hand at times and to make the necessary interventions possible.
Thank you. Dr. Patience, over to you.
Thank you very much. Excellent presentation from our panelists. My questions, I have a question for each and every one of you, so I don't know where to start. So I'll start with the senior, because I'm from Nigeria, we respect seniors. So there are seniors that are still in this time of pandemic. Dr. Ward, I want you to assist me here. When the pandemic came, everybody's locked down, everybody's shut down, you can't go. If where you could have gone to look for a senior to, interact or relate or support them, that support system was suddenly, I could call it suddenly, withdrawn from them. So many of the seniors are at risk. So with the way going forward, COVID-19, I don't know if it's going to go away or we're going to live with it. So how do we care for our seniors so that the stress can be alleviated? Some of them don't have family members here in Jamaica. The support they really have are those support from the church. So how do we reach out to them in this pandemic? Will there be ways that government or policy to say, look out for the elderly, so we can be able to really reach out to them? I'm not talking of just calling them by phone on WhatsApp, that's not what I mean. I mean, reaching out to them where you can be in their space in a positive sense. That is one.
Yeah, well, it's challenging because the natural reaction, as I put up, is one of self-preservation, looking after your family, trying to survive, because all of us are feeling the impact of the dual epidemic. But we have to understand that just a helping hand or doing some outreach in a new way. I mean, I remember a group came to us from Cassava Peace and they said they'd like to get care packages for the elderly. So we didn't do a huge impact, but we also did an impact where the older people, and a lot of them that needed the help were men, elderly men, kind of left alone, very little family support. And we also put reading books in the bag because Dr. Kim Scott, who runs the Child Resiliency Program, says reading and feeding. So they all got a book. And the idea was the elderly people could sit and read with the children in the home if they couldn't even do it. So, I mean, the WhatsApp groups have been good. Don't not use them. Don't not use, but it often is that people really do need an actual outreach. So I think we've seen it in the church, we've seen it in the police. The police were very active in giving out the care packages and reaching some of the, but how do we do it on a regular basis? How do we make it not just a few of us that are doing it, but if everybody does their part, it's a lot less. And I think understanding how important it is that assistance is, it doesn't even really have to be financial. I heard of a lovely story where Sistrin in Newlands has a group of women. They're just regular people. Most of them are unemployed, but they put together care packages every week to give a set of people in their communities so that they can sit and just talk for a few minutes, social distance, but this sort of thing.
Thank you, Dr. Ward. The next one question, then I'll add to, for any one of the panelists can answer this one. We're training children. Most of the times you talk about fathers and men reaching men, and when you look at the system, the school system, you have all of the female, from baby class to the next class is mainly female teachers. So how do we as a nation, considering what you have presented, how do we as a nation encourage the men into this profession? That is something we need to look at, because teachers are nowhere treated, in quote, and the salaries also not very high up there, so we need to encourage the men, because if men are in the classrooms, I think that might make a difference. So we can think about that.
It's a question?
Something to think about.
Okay.
All right, thank you so very much. Does that end our question? Okay, there are a few more, two more, okay.
What support is being given to NGOs that deal with gender-based violence, especially women and girls?
Could you repeat? Sorry.
What support is being given to non-government organizations that deal with gender-based violence, especially for women and girls?
I would say we really need to increase our allocation to our NGOs, because they are getting much smaller because of the economy overall. There are many companies that were on lockdowns and people volunteering. Everybody's under a lot of stress. But those small group interventions that they do, they're near to the communities, they're in the communities. They can call the health service, they can call the police, they can call children's services, they can call the children's advocate. They identify early the high-risk groups. We should have a percentage of our budget. I keep saying that about 15% of our security budget should be spent on prevention, effective prevention that we have evidence that works. And this is one of them, that areas that we know that there are programs that can work and are cost effective.
Just to mention quickly, the Spotlight Initiative promote of the UN, that is there, and of course it's specifically geared towards building awareness as well as ending violence against women and girls. And so there is funding there, so the listener, the person asking the question, can really go on that side, Spotlight Initiative, where Jamaica is concerned, and they can see possibly tap into any grant funding there as well.
But you see, the thing is, when we have it on a government recurrent budget, you can count on it.
Sustainable,
and it's also saying that we as a country have identified that prevention is important, that all these high-risk groups need to have services over time, and we want those NGOs to be providing the services, not spending their life writing project proposals to be able to, and not being able to provide the range of services that we know they have been doing over the years. And the church has been doing amazing work. Amazing work.
And the truth is, as you have said, the project proposal, one of the questions, as you have rightly raised, is the sustainability of it. After that period has ended and you need to carry on the program, there lies a problem again, you know? So.
Okay, so one last question.
Okay, how can the police create a more accommodating environment for male persons who are abused and are afraid to report same due to fear of discrimination from policemen, as well as how can citizens treat situations where they're in spaces where gender-based violence is taking place, example, at a supermarket or on the road?
Are you talking in the sense of the male being abused by the woman?
In the first question.
All right, so
For the first question.
all right, so as it relates to the Jamaica Constabulary Force creating a space and an environment for men to come forward, I believe that there's this perception out there that if the men come forward, then they maybe will be ridiculed or anything or other things by the police. But it's part of the transformation that's going on in the Jamaica Constabulary Force, because we started the process recognizing that as a situation where we start first with our diversity policy, where a set of males would be victims of abuse and they would not come forward. So our members, now it's part of our policy that no one should be turned away. So we have at a central point where we have established a national coordination department in our Community Safety and Security Branch headquarters, where they treat with all these matters. And it's part, maybe the person came on a little later, it's part of our domestic violence and our family violence. I like the idea of the family violence because sometimes when you say domestic violence, you know, it kind of have a particular definition that people log on to, so it's family violence. But when it comes to male reporting it, it's not something that they normally do, and we encourage them to come forward. If they're not comfortable in the regular police station setting, they can always go to one of our domestic violence eye care center and to make the report, and they will be treated with dignity, because part of what we find is that because there's not a lot of outlet for men to reach out and to report these matters, then they continuously resort to physical violence because there's this anger and insensitivity about them as victims of these types of crime, because there are women out there who abuse women physically. But for the most part, you don't really see those cases until they're very severe. And like Dr. Ward mentioned, that part of the cycle and part of what we see as police officer is the end result of a cycle and history of violence. So it's abuse over abuse, and sometimes even the people in the community and the space will not understand and say, why is it that you continue to stay, you continue not to take action? But a lot of times we find that people are not taking action because there are other things that are preventing them. There's a control. There is the financial aspect of it, where people feel that if you report the matter to the police and you take a particular action, somebody is going to be deprived of a benefit, could be for the sake of the children. So you continue to see that cycle of abuse because nobody wants to talk. And that is why I like the part of the Domestic Violence Act that allows for onlookers to help the victim. So a family member can actually report and put before the court a matter where here's a person that is constantly being victimized by a spouse, by a family member in that context, and can report it to the police and we can intervene. So I would want to say that if there's any male out there that is a victim of any kind of violence, report it to the police station. And if you go to the police station and you don't get the support you need, ask to speak to the officer that is responsible for domestic violence and these type of violent encounters, because we are at the point where if we don't be part of the solution to resolve these issues, and I mean resolving not just a one sit down will take, we have to do the referrals, and that is why we partner with a number of agencies that have support. So we partner with the Gender of Bureau Affairs, we partner with Women Inc., we are very much a part of the restorative justice process that is done through the Ministry of Justice. And we find that restorative justice, it helps both the victim and the perpetrator, because sometimes when you can sit with somebody and acknowledge that you have wronged them and apologize, that's all the person needs, is for you to recognize that you are doing something wrong. Because in your head, because of how you're socialized, and of course because of how we socialize our men and our women, then we find that there's something that we accept as norm. So when it happens, we don't reach out. We also have the victim support unit that we work with. The University Department of Social Health as one of the groups that we work a lot with, and Jamaica AIDS Support and the Dispute Resolution Foundation. Those are go-to places and entities that you can go to directly. But if you come to our eye care center, because of the reach and the collaboration, we can actually assess your situation and put you to support. So the Jamaica Constabulary Force doesn't treat with all the matters, but what we have is the reach to get you connected to support. So don't be afraid to report the matters, and you will be treated with respect and dignity when you make those reports.
Thank you. And remember that eye care means intervention, counseling, awareness, response, and empathy. Where may the eye care center be found?
So we have, you can find one at the Constant Spring, the Area 5 headquarters, at the Constant Spring Police Station compound. There's one at Matilda's Corner Police Station. There's one at the Morant Bay Police Station, the Yallas Station, Portmore Police Station, the one they call 100 Man. We also have the A's Police Station in Clarendon, Santa Cruz Police Station over in St. Elizabeth, the Negril Police Station in Westmoreland, Alexandria Police Station in St. Anne, and the Gale Police Station over in St. Mary. So that's where you can find our eye care centers. We are not in every parish just yet, but we have reach in all of them.
Okay. Thank you very much. 2 more questions? Okay. I was told that there are 2 more questions and then we wrap up. Please proceed.
Is the society's expectation or lack thereof to be blamed for fatherlessness or the current role of fathers? And do you believe that violence from women towards boys contributes to them being violent in adulthood?
I suspect that's my question. Dr. Herbert Gale did some research and points to the fact that violence towards boys particularly has also fueled what we see now in terms of gender-based violence, particularly IPV. So that is there, but I want us to understand also in many instances where the single mother or the mother in general is violent towards the child, and it's, let's say, the son, it's also due to the absence of the father. So there's a level of frustration. It's almost like she's a victim of her own situation. So it still boils down back to men really not being there in many instances, playing that role, even if it is that you're no longer with the mother in terms of intimately. There's a buzz term going around, co-parenting. If you remember out in St. Thomas, there was this mother, and it went viral, where I think she was beating her daughter with a cutlass. And many persons, she should go to jail, but not many really understand when the social workers and the different agencies get in, analyzing the situation, recognizing that there are other factors in it. You understand? So yes, it has caused it. In fact, many men right now who speak about their mothers highly, if you should sit with them, I can tell you, they will honor their mother on Mother's Day, they'll big up mommy, but if you sit with them, they hold some resentment because of how mommy mothered them or mommy spoke to them. Dr. Herbert Gale also said he interviewed shutters, and these shutters who have been in gang wars, have scars, etc. The most traumatic experience that shutter remembers in his life is when his mother was disciplining him in a way that's abusive, etc. So yes, and I also do believe that society also contributes towards fatherlessness. I do believe that slavery contributed to it. But personally, and in my space and who I speak to, I say to every man, own up to your responsibility. The point finger thing, it doesn't work. Gone are the days when our fathers, my father was incarcerated, and their other fathers, they never demonstrated right fathering skills. Many of them now are hurting or don't know how to do better now. The truth is they did not have what we have, which is a thing called technology. We can punch in certain things and get information. I'm not saying it's easy as 1, 2, 3, but we need to stop pointing the fingers. Stand up to our role and responsibility. Where we need help, we need to go and get help and play our part. That's my response to it.
Thank you.
Right, so if I could just butt in, because I just want to have this as a part of the consideration. So I'm taking it from the child's perspective. And what research has shown over many years is that boys who are in a home where there's intimate partner violence being perpetrated by the father and the mother,
Right.
they are predisposed and represented very greatly in statistics when they become adults and have their own relationships as perpetrators of violence against their spouses. And the flip side for girls who grow up in these homes, when they start negotiating intimate relationships in adulthood, they are more open to and susceptible to receiving violence. So they show up. Again, there's a a disproportionate kind of representation of them in the statistics as being victims of domestic violence because they saw this happen to their mothers when they were growing up.
Excellent point.
Thank you.
Thank you so much. Is that it for the questions? Oh, one final one. Okay.
Final question is related to gender-based violence at work. We're speaking about social violence, economic violence, psychological, and the distribution of resources related to those areas in relation to the pandemic currently.
I'm not understanding that.
So what they're asking is, what resources are there for gender-based violence at work?
In the workplace.
Right, so gender-based violence in the workplace in relation to the current climate, the current pandemic climate.
Well, I think that's a huge question. But I think certainly the human resource departments in different institutions would have a very significant role to play in taking a lead on this. You know, what are the practices within that workspace to deal with inappropriate behavior? And from where I sit, I think that would be a very good starting place. I know as well that the Bureau of Gender Affairs, some years ago, I think about 3 or 4 years ago, had a very vigorous program of educating and sensitizing persons throughout the government sector. And we created a network of gender focal points in each institution that really are very attuned to not just collecting data that's gender related and gender sensitive, but to practices that may not necessarily be on all fours with what's appropriate in gender balanced relationships. So I think that would be where this would find perhaps a very suitable place.
Thank you, and I must say that I'm one of those gender focal points. And the Bureau has also been instrumental in ensuring that there's gender mainstreaming throughout government's plans, projects, and programs. So we end on that note. Let me say, as we move forward, let us take into consideration the recommendations that have been put forward by our speakers. Let me just go through them one more time. Ensure that there are early interventions, there are data sharing, let the data speak to each other throughout our system so that there won't be any disconnect. And let us stop pointing fingers. Thank you, sir. And also note that the Jamaica Constabulary Force has made the effort to have focal points, gazetted individuals who can deal with the situation at hand, having recognized that in the past this was not very favorable to persons who came, not in all cases, but just to ensure that no one is turned away. And as I said before, this embraces the Sustainable Development Goal Agenda 2030, which says, let us leave no one behind. Let me thank you again for being a part of the 12th Annual Conference of the Ministry of Health and Wellness, Jamaica. Over to you, Dr. Grant.